Hi, everybody. Welcome to the Waiting Room Entertainment. Thank you guys for joining us again. For all of you that have not came to the Waiting Room Entertainment before, the Waiting Room Entertainment is patients helping other patients to find other organizations and events and clinical studies and whatnot in the community. So we actually bring the information directly to you at home so that you can use that and have access to it without having to hunt it down. We are not medical professionals. These videos are for entertainment purposes only, and we are trying to bring as much information to you guys as possible. So I want to welcome you, and I'm going to turn it over to Rod.
Hi, good morning, everybody. We are very privileged to have with us Dr. You're gonna kill me for this one. Sivaraman, is that correct?
That's correct.
Dr. Sivaraman with Nationwide Children's Hospital. Thank you all for joining us. I just wanted to introduce you and see if well, I noticed you have a fork on your lapel there. Can you speak a little bit on that and tell us what that's about?
Yeah, so the fork I've got here is actually a bent fork, and it was one of the symbols from the Arthritis Foundation from an initiative they had over the last few years, and I believe it's called Simple Tasks, and it just highlights the fact that people with arthritis and different autoimmune conditions can have difficulty just with simple daily tasks that we take for granted, but that there is support and that there's hope for treatment for these diseases.
All right, just wanted to ask, and then Amy, if you would just key in on what we're going to be focusing on here today.
Sure. So we're going to be talking with Dr. Sivaraman here today about some rare disease programs that are going to be going on February 28th at the Nationwide Children's Hospital in Columbus, Ohio. But first, I kind of wanted to hone in on your backstory, Dr. Sivaraman. What made you why pediatrics and why rheumatology?
Yeah, that's a great question. So looking back, I always loved working with children. And so somehow I just saw myself doing something with children. My mom was a teacher, so growing up, she was, taught kids, and we were often, working. She was in the same school, and so I was kind of around her career. But then also, as I decided to go into the medical field, I really felt like I wanted to make an impact with people's health. And so then I got drawn naturally to pediatrics. And rheumatology, especially pediatric rheumatology, is actually one of the smaller fields. There's a huge shortage in our field. There's a lot of states that don't have any pediatric rheumatologists. And so it's a field that is not offered for training in many places. Even within the US, many states don't have training, and many trainees go through all of their medical training without ever having exposure to these diseases. So some of the ways I got drawn to it, one was that I didn't want to limit myself to one particular organ in the body. Like I didn't want to do the heart or the lungs or the brain or the kidneys. And rheumatology kind of brings all of the organs kind of together. So I like looking at the person as a whole. And as you can see, like diseases like scleroderma and lupus, they can affect so many different organs in the body. And so you really want to be aware that you might be missing something if you're not looking for it. And then I did have a family member that actually passed away from lupus, from kidney disease, while I was in medical school. And so she had developed symptoms during her pregnancy, and the family at the time wasn't really aware that this was a condition that could happen to a young person. And then she went into kidney failure and passed away. So I think that kind of made an impact on me during my years with training. And then I was slowly kind of felt like I would think about this specialty, and I'm glad I did.
Sure. I'm very sorry about your family member. That's awful. I think all of us, Rod being a caregiver and myself and Dummy being a patient, we kind of all realize the gray area of rheumatology and how, your disease kind of affects every part of your body. So I think that's great that you kind of felt that you were passionate about it. I want to switch gears and talk about Rare Disease Day and what Nationwide Children's Hospital is doing for Rare Disease Day. Do you want to tell us a little bit about that?
Yeah, so we're very, very excited to be planning real hard for our 5th annual Nationwide Children's Rare Disease Day event. So Rare Disease Day is a global event. It's actually celebrated around the world on February 28th every year. And it highlights all of the different rare diseases that can occur in people. And the definition for a rare disease is actually something that affects less than, I believe, 200,000 people within the country. So it's a disease that affects a small number of people. But when you actually put these diseases together, they are a huge, huge number of people that can get affected by it. So millions of people might actually be living with a rare disease and might not have resources and might feel alone. So this particular event, it's highlighted by by NORD, which is the National Organization for Rare Diseases. And so it's a worldwide celebration. And every year they have a theme and they just do events around the world. So in our institution, our research coordinator, actually, Joanne Drew, had this idea to do an event, and she has a child with a rare disease. And so she felt as a parent that she felt so alone because there wasn't a lot of support and a lot of people hadn't heard about the disease that her child had, and he ended up needing a bone marrow transplant. And so it felt very lonely. And so she felt like this would be something worth highlighting. And then from my side, the interest came about because, like, from the years while I was in training, I kind of was drawn towards some of these rare diseases. One of our conferences, one of the doctors referred to us as the doctors of the really weird stuff. So you can kind of relate to how that feels. And we have a huge research organization that's called CARA, which is the Childhood Arthritis and Rheumatology Research Alliance. And it's basically a wonderful research organization that brings together pediatric rheumatologists from around the US and Canada. And because our diseases can be so rare, it's hard to do research with these diseases because you need a good number of patients to actually do any kind of meaningful research. So what CARA has done is that they have a registry, and the registry just means they're not doing specific research on a single disease or a single patient, but we're able to work together and input data about patients without any of their identifying information. And specifically, it works on juvenile arthritis and lupus in children. But within CARA, there's separate groups working on different diseases. And so within that, there's a whole group working on rare diseases. So I've been part of that group. And so there's a separate group just working on scleroderma. There's a separate group working on vasculitis, which is blood vessel inflammation. And those can be very serious and cause a lot of complications. So I'm part of those two groups within the rare disease group. And so that gives us a way to kind of help those patients and do research. So between my clinical and research interest and Joanne's interest as a parent, we kind of decided to start this event back in 2019. And so our first year, we kind of just launched it and we had a pretty good turnout. And then the second year, it really took off. And we had close to 100 people attend. And if you can imagine, the end of February of 2020, right before everything shut down for the pandemic, we had close to 100 people packed together on stage, parents, children, physicians, providers, researchers, different foundations that are part of the event. So it was really kind of a coming together. And so the way we planned the event, then of course we had to go virtual for 2 years, but this year we're excited that we're back in person. So the event will be back in person on our campus, Nationwide Children's Hospital in Columbus, Ohio. And we're affiliated with the Ohio State University, so we kind of partner with physicians there too. And we work with medical students and trainees, and we train rheumatology fellows for adult and pediatric rheumatology. So this kind of brings everybody together just with that passion for rare diseases.
Amazing. So is it open to patients and families as well?
Yeah, so it is a patient and family event.
Okay.
It's primarily for patients and families. And the reason, the goal of the event is to bring people with rare diseases together just so they realize they're not alone.
Perfect. That is amazing. And well, as you already know, all of us, we will be there at this event in February. So it's going to be great. And I think it's great that, you're partnering with other organizations, because I think a lot of times people kind of get stuck in where they only want to do things singly or singularly. So I think that's amazing. I want to kind of curve back to CARA. and find out how you would register for that, or how you could sign up if you're a pediatric patient or you have a child that's a pediatric patient and would like to be part of it. Pardon?
For research, is that your question?
Yes. Yeah.
Yeah. So CARA, it's their website, I believe is caragroup.org, CARRA group.org. And so patients, families, anybody can look up some of the studies. So within CARA, as you can imagine, a lot of research is limited by funding because we may
Right.
have all the dreams of doing research, but in the current environment, unless it's funded, it's very hard to be able to do the research. And even pharmaceutical companies aren't ready to put millions of dollars to develop a medication for rare diseases because there's only a few people that actually have the disease. So they're not sure how much of a market there will be. So what CARA does is we do partner in some situations with pharmaceutical companies, but we have specific, the website will tell you what current studies are in process. And most pediatric rheumatology institutions within the US, most children's hospitals that have a pediatric rheumatologist are going to be part of CARA. So if somebody has a child with one of these diseases, they would just ask their doctor if they are part of CARA.
Oh, okay. That's
So
amazing.
because it has to go through the doctor that they're seeing.
Right.
So basically you could ask your doctor and say, are you part of CARA? And then they would be able to get more information. And our CARA meeting is actually just coming up at the end of March in New Orleans. And we actually have patients and parents attend the meeting.
That is fantastic.
Yeah,
You
that's
might
really neat.
come to the event because we have a parent who's here who has a child with juvenile arthritis. And what's amazing is we have some of these amazingly driven parents who actually help the research to actually be able to do research. And so one of the parents, I'm hoping she'll be at the event, but she's a local parent in Columbus who's she's one of the parent co-leaders for the research group.
That's amazing. That's so good. I think, you know, I mean, I can speak for myself. When I was diagnosed, it was a lot of unanswered questions and trial and errors through lived experiences. So it warms my heart to kind of see that we're going somewhere in terms of research and getting more managed care out there for patients. Rod, do you have any questions for Dr. Savara? I don't want to talk the whole time.
I know, right? Well, no, at this time, what I keep coming back to, since I'm the caregiver within our group here, is do you have any like any special groups or any special seminars within the rare disease days that's going to give opportunities for caregivers to kind of meet together, or maybe even have a spokesperson for that area?
Yes, absolutely. So that's a great question. And as a parent myself, I do realize the importance of the caregivers, and especially with some of the more complicated diseases, because the caregivers have to take care of themselves before they can take care of their child. I think that's a great idea and a suggestion that we could try to put in for future for the caregivers. We don't have a separate session, but the way the event is structured is basically there's a keynote speaker who will be is going to be talking about gene therapy, which is something Nationwide Children's is kind of leading the way with. That's going to be our keynote speaker. Every year we do a different keynote speaker, but this year that's the topic. And then we have specific topics that cover research, and then cover advocacy, and then cover like the patient experience. And then the last part of the event is a patient panel, where it's maybe patients or caregivers that are on that panel. And a lot of that is going to be those lived experiences, what they went through. Some of them might be patients themselves or a parent or caregiver of a child. So that often comes up, is what kind of support there is. So the patient panel is probably the one that'll cover it the most. And then the big thing about this event, like it's a lot of it is the socializing that happens. So we have dinner there, and just during the breaks or just registration, you know, they might just see another parent in the lobby and they're like, oh, my child has the same condition, or say they're struggling with shots, you know, just to meet another parent, like it's so hard giving my child a shot every week, you know, what tips do you have? So it could be those, or what tips do you have for school or going off to college? These are very common questions that come up. And so as a physician, I can see a lot of times in my clinic where I might tell a family some kind of recommendation, but if they hear it from another parent or from another child, that's much more powerful. So
Yeah, it sounds like it's a perfect, like a social networking opportunity for families and the patients. I think you had a story about how the patients kind of connected and how it benefits them as well.
yep, we had this group of boys that met at the event, and till then they had never met another person that had even heard about their disease, let alone have the same disease. And I will say the majority of our diseases are more common in women, whereas this particular one is called chronic recurrent multifocal osteomyelitis, or CRMO. It's a long name. But these kids just like, they were able to eat dinner. There was this whole row of kids at the same table eating dinner together. And it was just unbelievable to see them. And they've become fast friends since then and kept in touch, gone to each other's birthdays and all that.
I
You
could only
know,
imagine.
you are going to have a section for children, right?
Yes,
There's going to
absolutely.
be
So
activity.
yeah, so during the time, because the talks can be, we don't expect the kids to be sitting through and listening to, the talks. But, and again, the talks are short, so, they're not like super long or anything, and they're definitely meant for lay person audience. Like, you don't have to know any medical background to come to those talks. But the children will be in separate, like, breakout rooms almost. So we'll have the younger kids, and then the older kids, like teens. And I will say, having teenagers myself and taking care of teenagers, a lot of times it's very hard. They just want to kind of be in their own shell, and they're going through enough as it is being a teenager. And then on top of that, you put on a rare disease or even like a disease like scleroderma that might be changing their appearance. They definitely have a hard time and struggle with it. So I really, really encourage our young patients to come to these events because it can be very impactful for them.
Yeah, I'm bringing my daughter. She's a caregiver. And she's only 12. So, she's really excited to come. Aren't you going to have like a flying horse farm, or I forget?
So
Okay.
Flying Farms is basically an organization that runs camps for kids with different conditions. So they're amazing. They're just about an hour outside Columbus. And you can even look at their website to get information because they are enrolling now for their summer camps. So they have, each week they have a theme. So they might have one theme that's GI diseases, one theme that's cardiac diseases. So every week there's a theme. And so there's a week that's assigned just for rheumatology diseases. And so that's how, a lot of our juvenile arthritis patients love going to camp. They have all kinds of activities, a zip line, they do a lot of swimming, archery. Part of their goal and their motto is to just let kids be kids. Because these kids are going through enough just growing up and then having a health condition where they're coming to the hospital and seeing doctors and getting shots or infusions. So we really want them to just have a normal childhood that week just to kind of get away. And sometimes I tell the parents it would be kind of a break for them too. When the kids are gone off to camp for a week and they can get a little break.
And that's really hard. I mean, as a kid, we have a friend, as I mentioned before the show started, and she was diagnosed at the age of 5. Now she's in her early 20s, but she spoke when we went to Capitol Hill. That's one of the things she talked about, how it was a battle to just create or obtain that normalcy, and just feel like being part of the kids, just being one of the other kids. And she was very fortunate. Everywhere she was able to speak to the other kids and help them understand that she's battling something, so, the other kids kind of benefited from being in the same classroom with her and learning about a real life situation that, she's going through. And it was just a constant thing that she had brought up, that she wanted to have a group or just someone that she can call that would actually understands. And she didn't really have that, honestly, until she found like our groups. We have some scleroderma communities, and we were able to connect her with others. Now, she was rare. It's not a lot of children with scleroderma, just like there's not a lot of children with other rare diseases and so on. But for you to have an event like this, it just means a lot. Is there something in the back end where families and even the children could probably reconnect with Nationwide Children's Hospital to kind of just get more questions answered?
Absolutely. So it's definitely the goal of this event this is just the beginning. You want them to connect and be able to provide resources. So the hospital itself has multiple clinics that take care of rare diseases. And actually, that's been one of our challenges, is to even spread the word within the hospital, because all the specialists kind of tend to be in their own little world, and we have to kind of connect them and say, hey, scleroderma also has lung disease. So then we're working with our lung doctors and saying, and so one of our pulmonologists has an interest in autoimmune diseases in the lungs. So she's been a kind of a champion for us on the lung side of things. We work with our genetics doctors and our immunology doctors and researchers. So we kind of need all of them, to really be able to spread the word. And then so the parents basically can connect at this, and they can choose how much they want to be involved. Because sometimes people don't want to, be dealing with too much of that, but depending on what stage they're in. So one of the things I try to tell families is, when they're newly diagnosed, it can be very overwhelming. Because there isn't really a roadmap, you don't know what's ahead, and then you put in a rare disease, and doctor walks in and say, hey, they might have scleroderma, and then we're like, well, we're not really sure what treatment's going to work, but here's 1, 2, and 3. I mean, it's very, very overwhelming. So if a family that went through this, say 2 or 3 years ago, and now their child stays in remission and is doing well, can actually give back to the community, because now it's like, okay, now there's a newly diagnosed child that I'm seeing now. So that parent could be that advocate and say, hey, we went through this with our child 3 years ago, but now she's in remission, they're growing, they're going to school and camp and going off to college. It's very helpful to families. So we try to do that. We have some programs for parent mentoring and like a peer mentoring program. So there's a lot of resources available.
Is there the same type of opportunity for the medical professionals that attend this as well? Like they can come back and ask questions?
Absolutely. So we definitely encourage our medical colleagues to attend. Again, I will say, I think everybody's stretched so thin. So sometimes we have to tell them, hey, you'll be surprised, what you learn. Demisha and I have done I do a panel for the medical students every year at Ohio State. And what we try to do, it's part of their rheumatology curriculum. So we make a patient panel that I really want to be a diverse group. So I want people of different ages, of different ethnic backgrounds, who were diagnosed at different ages. And so this way, and of different diseases. And so each patient or parent gets to share how their child or the person themselves, how they were diagnosed, what they struggled with. So for example, one of the things that's been shown with rare diseases is that the average person with rare disease sees up to 12 medical specialists before they get a diagnosis. And I'm sure those of you with scleroderma can attest to that from your own journey. So the more we make medical professionals aware that these diseases can have different ways that they present in. And I think one of the things we've talked about, I think Demisha, you had mentioned, so oftentimes in medical school, you're told if you hear hoofbeats, don't think of zebras, think of horses. But with rare disease, they actually have the opposite slogan, that sometimes it could be that zebra. And so you don't want to be missing that. So we're so focused on teaching them to recognize those horses that they're actually missing the zebras. And I think rheumatology is one of those fields where we definitely see a lot of zebras. I almost sometimes call them the unicorns, because even among the zebras, sometimes we have even more rare conditions.
Yeah, that's so true. I think your program sounds amazing. Rare Disease Day sounds amazing. It's February 28th at the Nationwide Children's Hospital in Columbus. How can patients, caregivers, the community, how can we register for the event? Yeah,
so there is, you can register online at nationwidechildrens.org/edu. You can also email us at rarediseaseday@nationwidechildrens.org.
Awesome.
And it's fully in person this year, but it will be recorded for a future viewing if people aren't able to be here in person.
Amazing. And I think you said this, but I want to reiterate, it's a free event.
Correct. Online, and it's run this year. We're partnering with our education department, which in the past, this was kind of our own little event that Joanne and I would do with our own, like on our own time, kind of organizing and begging people to help out. But now we have kind of partnered with our education department. So things are a little bit different. So it's under the site where they do like medical conferences. So that's why if people look at it and they're like a little bit thrown off, that's why, because it's the same team. But there is no charge for the event. It's completely free. Dinner is provided. So this way, and it is a school night, but we're cognizant of that. But February 28th, and it happens to fall on a Tuesday. We have found in the past, we played around with events on a weekend or on a weeknight, and we actually found better attendance on a weeknight, believe it or not. Sometimes we would have an event on a Saturday and we'd go through all this trouble and like 2 people would show up. So we've actually had better luck. So we've just kind of stuck with that model. And this year, February 28th falls on a Tuesday. So we're happy.
Well, it sounds amazing, and I want to thank you so much for your time and everything that you do for the rare disease community and for pediatric children. And we will be there. The waiting room will be there, and we will have a table as well. So if you guys are watching this, come and check it out. I'm sure it's going to be great. And yeah, thank you so much, Dr. Sivaraman.
Oh yeah, thank you. I'm so happy to get the word out. And you know, it's also the event is posted on Facebook. It won't be like streamed through Facebook, but the event is there if somebody's searching for it under Nationwide Children's Hospital. We usually have these light sticks that are on the corner by the hospital, and we get them all lit up because there's like colors for Rare Disease Day, and there's these bright like rainbow colors. So we'll have our light sticks lit up. We kind of compete with the Heart Association because February is also American Heart Month, so we kind of have to. But we'll so, you know, we hope people can come, and Nord will be there. So it should be a fun event.
Yeah, we are so excited. And
yeah, I can't
Debbie,
wait to meet you in person. Like I've
Yeah.
been knowing you for years now and have never been able to meet you in person. So this is going to be
Okay,
super cool.
And I will say, yeah, so we do have all of our safety measures too. I should mention that as a healthcare provider and being in a hospital setting, because I know a lot of people with scleroderma and autoimmune diseases are immunocompromised. So in the hospital, we are still wearing masks. So, you know, masks will be required at the event. And the space we have is actually very spread out. It's a large, beautiful auditorium that was actually renovated right before the pandemic. And then we have separate rooms where the kids will be. So, and then a huge lobby area where all the tables will be set up. So there's enough room for people to, you know, spread out if they need, and just, you know, should be comfortable. Yeah, and parking is available right there too. So just in the adjacent building. So and now that we're partnering with education, they're taking care of a lot of the audio visual things like that we had a lot of glitches last year.
Well, thank you so much for sharing all that information. That's just wonderful. We're so happy to be a part of something so special for the community. Anybody that is watching this, we would like to also remind you to like, share, and subscribe to the Waiting Room Entertainment for more videos like this. We are trying to reach 1,000 subscribers. That's one of our goals. But Dr. Sivaraman, we are so happy that you came and spoke with us today. Rod, do you want to close this out?
I just want to say thank you very much. And also everyone watching, thank you for joining us again for this episode. Stay tuned for the next one. Thank you.
All right.
Bye,
Good to see you
guys.
guys. Thank you.